Hello everybody, Jeremy Latham, the hip surgeon here. It's April the 23rd, it's a beautiful spring day out there, the sun is shining, it's 24 degrees and anyone would think it was the middle of summer. It's the fifth week of our lockdown here in the UK. People are starting to get a bit more mobile. Certainly the roads were busier today when I went down to do my ward round. Lots of trucks going down to the port and also lots of tradesmen's vans and more cars on the roads and seemingly more people out and about as well. Perhaps it's the good weather, perhaps people are just sort of getting a bit fed up with being cooped up indoors. Either way, we're waiting for the government to tell us when things will start to move again. It's looking more likely that there'll be a softly approach to the release of the lockdown. Some businesses such as the DIY stores are starting to open their doors again, but it's likely that we'll have social distancing for some time to come and maybe recurrences of the COVID disease later in the year. All that's of course conjecture. All we can do is be guided by the experts in the Public Health England office and of course by the government. Lots of controversy out there. I thought I'd put together a short video about the COVID-19 problem and what we might expect at the end of it. I'll speak to you again after the short presentation. If you like the video, please subscribe. If you've got any questions or comments, put them below or get in touch. The details will follow at the end. Thank you for watching. I'm Jeremy Latham. I'm the hip surgeon. The coronavirus pandemic has caught the whole world by surprise. This viral disease is very contagious. In some people it can cause a severe pneumonia which is rapidly fatal. People who are elderly or who have underlying diseases are particularly susceptible. The disease has had a terrible impact on the health services in many countries, particularly in Italy, France and Spain. Governments have tried to flatten the curve of cases so that health services are not overwhelmed. Here in the UK we've been on lockdown since the end of March. Restaurants, cafes, pubs, clubs, bars, even places of worship have been closed down for the foreseeable future. This is normally a very busy time for tourism, but of course all this has come to an end. Of course humans have always had to deal with adversity. We've always had infectious diseases which have caused epidemics over the centuries. In my life we've dealt with the Cold War. Here's my father who was a Cold War warrior who kept us safe during the 1950s and 1960s. When I was a medical student, we had the terrible scourge of HIV and AIDS. We've also had to deal with national and international terrorism, particularly with the troubles in the UK, and of course the rise of Al-Qaeda and ISIS. In recent years, we've had the fear of climate change and its consequences. Humans have always lived in fear of their own mortality and the end of the world. The COVID pandemic is no different in this respect. What's going to happen when the lockdown eventually finishes? It seems likely that social distancing will have to persist for many months to come. People will understandably be reluctant to mix in large groups, and this will have an effect on shopping, going to the gym, going to restaurants, hotels, clubs and pubs. Travel will certainly be affected. Many countries might well limit the number of tourists that are allowed into their countries. One of the consequences of the lockdown is that we haven't been able to do elective surgery for several weeks. It will take us quite a while to get up to the volumes that we used to do before the lockdown. Patients will have to wait longer and their conditions might get worse. After the pandemic has been dealt with, this will be a time for re-evaluation of those treatments which really work. New technology will come along which will help us to deal with the problems that we face, rebuilding our economies and our health services. We'll all have to focus much more on value and those treatments which have strong evidence to support their use and efficacy. In the next few years there will of course be inquiries and investigations into what happened. People will want answers and there will be recrimination. Legal action will follow inevitably. All of us want this terrible pandemic to end as quickly as possible. It's likely we'll have to live with recurrences of the disease, probably for a few years more. Surgeons like me are desperate to get back to work, to do the operations which help our patients, relieve them of pain and allow them to get on with their lives again. I've been lucky enough in my career to live through a time of enormous technological change. These advances have helped us to treat more patients safely and effectively. I have no doubt that human ingenuity will get us through this crisis. Life will never be the same again, but then it never is. Hopefully the lessons we learn now will help us to deal with pandemics which will inevitably come in the future. Well, I hope that you found that interesting and informative. We're all desperate to get back to work, to start operating again, seeing patients, sorting out their troublesome hips. Of course, this is just one part of the elective surgery that's been put on hold for so many weeks, if not months to come. More worrying, of course, are those patients who've got undiagnosed cancers which need assessment and treatment. We're going to be dealing with the fallout from this pandemic, not just because of the mortality and morbidity of the disease itself, but also the consequences of not being able to see patients, treat them in a timely, appropriate way. I'll keep you updated on news as it happens. I hope that you're all keeping safe and well and not getting too frantic being locked up at home. If you've got any questions or comments, please get in touch. The details will follow after this. Please subscribe to the channel, and if you've got any comments, put them below. I'm always available. You can get hold of me through the website or via my secretaries in the office. Thanks again for watching. I'm Jeremy Latham. I'm the hip surgeon.